Well, good morning. Welcome back. It's 9:44, and as you know, February is Heart Month and a great time to get an annual physical examination. Well, last November, listen to this. The American Heart Association and the American College of Cardiology released new blood pressure guidelines, so it's important to know those numbers. Good friend of the show, Anna Hembrick, a nurse practitioner, is here with a few potentially life-saving tips that you need to know. Nice to see you, Anna.
Nice
How are
to see
you?
you, too.
It's a pleasure.
Thank you.
All right, Anna, this is big news in terms of keeping your heart healthy.
Yes.
They've crunched the numbers. There is a new normal now, right?
Mm-hmm.
Tell us about that.
So for about 14 years or so, patients have had like a leeway as far as, their blood pressure readings. So now, before, we generally did not constitute high blood pressure until you reached about 140/90. That's changed completely. Now the new normal is 120/80 or less.
Can you tell us, Anna, when you hear those numbers, the higher number, lower number, what does that mean?
So the 120 is the top number, systolic. That describes how your heart is contracting, and that's the contraction, and then the relaxation is the bottom number, diastolic. So top number systolic, bottom number diastolic, 120/80 or lower is now the new normal, okay?
And that's good.
And that's good, right, you want that. And because of that, we're doing at Minute Clinic every Wednesday in February. You can come and know your numbers. So you can come for free any Wednesday in February, including Valentine's Day. February's Heart Month. We have our red on
by the way, yes.
And you can know your numbers and get those for free, with or without insurance, for free every Wednesday in February.
All right, tell us about some blood pressure issues, mostly hereditary, or is it lifestyle, or maybe a little combination of both?
A little combination of both. So the norm is 120/80 or lower. Now they have new readings for elevated. Elevated blood pressure is 121/129/80. And so this is not hypertension, but this is just an elevated blood pressure. And your provider will say, hey, we need to do some lifestyle changes. Well, what are lifestyle changes?
Yeah,
We
exactly.
hear that all the time.
Yeah.
That is decreasing your salt intake, stop smoking, incorporate an exercise program into your routine, decrease your stress level. Okay.
Sometimes that might fall on deaf ears, right? Because we hear it so much, but it's a lifesaver. It can save your life.
It's a lifesaver. And it's a running theme throughout heart health. And so, but before you start any of the exercise program, you want to make sure you talk to your doctor first to make sure it's right for you. You don't want to go to a Navy SEAL boot camp for 3 hours. If you're a sedentary person, you just kind of want to ease into those things. So make sure you talk to your provider first.
When you start making those lifestyle changes, over the course of how long? Days, weeks, months, are you going to start to see a change when you crunch those numbers?
It takes a couple of months. And
okay,
so
couple of months.
What we're trying to avoid is the stage 1 hypertension. So we talked about elevated. Stage 1 is actually 131/139/80/89. And at this point, your doctor is saying, okay, lifestyle changes. However, we do something additional. It's a 10-year risk for cardiovascular disease. This is we take a couple of things, your age, your weight, are you diabetic, or do you have high cholesterol, and we crunch those numbers and it comes up with a percentage. And this is percentages, how likely are you to have a cardiovascular event in 10 years? So how likely are you to have a heart attack or a stroke in 10 years based on this scale? So if you are 10% or less, we just recommend lifestyle changes. But if you're higher than 10%, we'll say you need to be on medication, and we also need to do lifestyle changes. So you see those lifestyle changes throughout the entire process. We all can benefit from those things.
Do you feel the symptoms? We have about a minute left. Do you feel the symptoms of hypertension physically, or is it just something that a doctor or nurse practitioner is going to recognize?
You can feel them. You can have floaters. When you're looking around, you see floaters, the things in your vision. You can have headaches. You can have just weakness. You can have numbness and tingling, and then you kind of get into those cardiac issues. You can have the jaw pain, the arm. The arm pain, left arm pain. You got to be really careful. But 140/90 is stage 2 hypertension. Have to be on medication. We got to get that blood pressure down right away.
So make some changes.
Make changes.
Save your life
now.
And listen to your body.
Yes.
All right. So
absolutely.
Cut out the salt.
Yes.
Make some lifestyle changes.
Yes.
Alcohol as well.
Yeah, cut it down.
Cut it down.
Cut it down.
And exercise.
Exercise.
All right. You're speaking the truth.
Thank you so much. It was a pleasure. Thank you.
Crunching the numbers with Anna. For more information on the American Heart Association's new blood pressure guidelines, we're going to post a link on Anna's information right on our show website early this afternoon at WTVR.com/VTM. Thanks so much, Anna.
You're
we
welcome.
appreciate it.